Well, a very good morning to you, Michelle. About 99 patients, we understand, have already been admitted to this facility. They were admitted from the 15th of June, we're told by authorities. You'll remember earlier in the week we spoke to the Health MEC here in Gauteng, Dr. Bandile Masuku, who indicated that perhaps they're seeing signs of the peak here in the province. He said that in every 2 days they're recording about 5 deaths, and that is a concern. So these facilities, of course, are expected to be filled and be used for those purposes as the province reaches its peak. But this facility, Michelle, I'll tell you, is a quarantine site, we're told. It's one of those quarantine sites that are set aside by the Gauteng Department of Health, meant for people who have either tested positive or are people under investigation. So the 99 people that are inside there have either tested positive and others are people under investigation.
Yeah, and Bandile Masuku also saying that he's quite concerned about the fact that even though the Western Cape still leads in the total number of infections, Gauteng does now lead in the highest number of active COVID-19 cases. So, Linda, this quarantine site, this field hospital, is it also a place where patients who perhaps have been previously hospitalized with COVID-19, they are now out of the woods, as it were, they are recovering, but they do need to self-isolate? Is that also what this quarantine site is for?
Well, what we know, Michelle, is that it's for people that have tested positive and those who are still under investigation. You'll remember when these sites were set up, what we were told is that they would ease the burden of hospitals. We understand that there's about 8,000 beds in the province at this particular point. These are from both the public as well as private hospitals. So this site is meant to ease that pressure for people that don't necessarily need hospitalization. We understand that about 1,000 people have since been hospitalized in the province, and as they're preparing for that peak, these sites are coming in quite handy to ensure that there isn't much traffic when it comes to those that seriously need the attention of health workers. Michelle?
Having said that, Linda, these field hospitals are staffed fully with hundreds of medical personnel.
Indeed, Michelle, and we're yet to get that figure of how many health workers will be coming here. But we also understand that this facility has about 500 beds, but has a capacity to fill about 2,000 beds. So if the need arises, they would, of course, have to ramp up in terms of their the health care workers as well as those beds. But earlier, when this particular facility was launched, we spoke to the MEC and we asked him if they would need, more health workers, and he indicated that when the time comes, they definitely will need more health workers. He's also concerned about the number of health workers that are testing positive. Michelle, you'll understand that this has a bearing on how the country fares in terms of treating COVID-19 patients. He says that they're actually, conducting surveys across the province, and they've found that many of the staff, healthcare workers, are infecting each other within the hospitals, and the infections are not necessarily coming from the patients themselves. So trying there to also alleviate the issue of stigma that is attached. He says that other healthcare workers that now fear attending to COVID-19 patients, and therefore that has given them the sign that they should perhaps be going ahead with the survey that will determine exactly the trend when it comes to the infection rate amongst healthcare workers.
Yeah, absolutely. It's what the World Health Organization has been saying. Even though the situation is improving in the European Union, at least around the world, infections are still increasing. South Africa is certainly not out of the woods. Linda Mnisi is tracking that story for us from Nasrec.